Hello and welcome, ladies and gentlemen, to a new edition of the Daily Debate. In tonight's show, we're going to be focusing on the healthcare system. Now, Egypt is promoting its own healthcare system, also promoting cooperation with the African states. And joining us here in the studio to shed more light on this very critical and important file is Dr. Jamila Nasser, the head of the Working Group of Prevention of the Egyptian Cardiology and an African representative in the International Society. We're also joined by Dr. Ahmad, Kamel, Associate Professor of Neurosurgery and former advisor and spokesperson to the Minister of Health and Population. Thank you very much for joining us this evening.
I'm very happy to meet you.
Ladies and gentlemen, before we start our discussion, let's check out this report regarding President Abdel Fattah al-Sisi actually addressing the UN General Assembly a little bit of a while ago, talking about the healthcare system and talking about cooperating with the other African states and promoting healthcare and health insurance. And we'll be right back.
Addressing a session on the sidelines of the 24th round of the United Nations General Assembly in New York, President Abdel Fattah al-Sisi expressed his pleasure to take part in the discussion of the subject of providing the comprehensive health care. Meantime, half of the world population was still suffering from failure to obtain the primary and sustainable healthcare services, in a way that affects collective efforts to achieve the third target of the Sustainable Development concerning ensuring a healthy life. Consequently, he stressed that all governments and partners of development must seek finding good and quick solutions to enhance the primary health care, being an essential human right for a decent life. Within this context, President al-Sisi reiterated the efforts of providing the comprehensive health care would not be completed without access to medicine and technology of health, and building partnerships and coalitions among governments, companies and international institutions. The President expressed his appreciation to the 5-year vision of the World Health Organization that works on extending the healthcare umbrella for all peoples without exception. He noted that in the recent years, Egypt has put citizens' health on top of its priorities, launching the 100 Million Health campaign that examined the hepatitis C virus patients and non-communicable diseases, as 60 million citizens have been checked so far in less than 1 year, and drugs have been provided free nationwide for more than 1 million patients who were having virus C. President al-Sisi noted that all these efforts had been praised by the World Health Organization in its report delivered to him by its Director General during their meeting in Cairo late last August. The head of state noted that Egypt had actually started carrying out the first phase of the comprehensive health cover for all Egyptians. For this end, Cairo launched several initiatives, including eliminating critical surgical operation lists that covered about 250,000 patients. Moreover, he said that Egypt shed light on the health problems facing women and children in initiatives like supporting Egyptian women's health and detection and treatment of hearing-impaired newborns. A campaign to detect obesity, anemia and dwarfing of schoolboys was also launched. President al-Sisi affirmed that Egypt's commitment to healthcare is not restricted only locally but extends to the African continent. It was generalize a 1 million hundred health initiative in cooperation with the World Health Organization in African countries within the African Union's development agenda for 2063.
Welcome back, ladies and gentlemen. Starting off our discussion right away. Dr. Nasr, first of all, now we've been speaking and talking extensively about the importance of actually working on the education file and the health file here in Egypt. Now, the government has exerted a lot of effort in really working and establishing a new healthcare system, a new health insurance system. Now, how do you feel the government and the Ministry of Health has worked so far and achieved so much in this very critical file?
First, I'm very happy to be with you.
It's a pleasure.
It's my pleasure also, but you're talking about a very important file in Egypt for education and health, as you have done. Of course, when you are talking about health, you're talking about prevention. And when you look for the WHO definition for the health, it's just to prevent disease, not just to wait and for the disease to come and then to treat. So you have to prevent and prevent and prevent. That's why I think this is very important to look for the disease and prevent its occurrence. I think there is many achievements which had occurred in the few less than 1 year. This was the initiative or the campaign for the 100 million,
healthy lives.
Yes, this was just an amazing. I just looked for the checking for more than 60 million Egyptians. So I think just was an amazing step. And even 1 million of them had received already medications for free. This is with another, it's not that only, but many others steps were taken to be in this way. Also, the education, of course, is important because you have a health system. You have to educate. Look for the continuous medical education for the nurses, for the pharmacists. I think we do have, Egypt have by far had many good steps in this way. Also, it extended to Africa also, because as we had seen that this initiative had been proposed to extend to all over Africa as well.
Yes. Dr. Kamel, now, as opposed to the previous health system, which was really seen as below the standard required for the Egyptian citizen, how far do you think the new health system has advanced to meet the international satisfactory standard for the Egyptian citizen?
Well, first of all, thank you for having me. And, well, we have to take a step back. This cannot be evaluated like this, and this compared to whatever we had before. When you said, like, previous health system, there wasn't a previous health system. There were, like, bits and pieces that put together might provide some sort of coverage, because you had insurance coverage for students and children in preschool ages. You had insurance coverage for government employees. You had insurance coverage for private employees. And then you had the vast majority of Egyptians who were covered by something, certain decrees that they have to apply for every time they get sick. They have to get a report and then get an approval and get a financial compensation to pay for their treatment. This was not a sustainable system because it was financed by the budget. And you cannot predict what you have, and so you allocate money, and then you keep on adding money, and you end up with a budget deficit at the end of the year that you can do nothing about. What we are proposing here is a sustainable self-financing system that is going to provide coverage, complete coverage, comprehensive medical coverage, as they call it, for everybody that lives in Egypt. Egyptians abroad are exempt so far. As I understand, their participation is optional. But everybody who lives in Egypt will have health coverage that is sustainable. And this is going to be rolled out in over 6 phases till 2032. And this project, when it's complete, you can start evaluating and comparing to other health systems. But this project is crucial because the lives of Egyptians after it are not going to be comparable to what's before. Currently, like you have like 50% of Egyptian families risk going down one step in the economic scale, like going below the poverty line or going below the poverty line, if a member of the family gets sick, because the healthcare costs are very expensive and they don't have any form of protection. Now you're providing insurance so that everybody, if you have a car accident, if you get sick, if you require medical treatment, advanced surgery or anything, you're covered for life.
Well, Dr. Nasser, now we are in the early steps for applying such a strong, solid health insurance system. Now, we started off with a few initiatives, mainly the 100 million healthy lives, talking about the double burden of malnutrition in Egypt, worked on eliminating hepatitis C. Now, these steps taken and these initiatives, are they more of a medical achievement in Egypt or a medical achievement in Egypt, but also a sign and a showcase to the whole international community of how serious the government is taking such a file?
Yes, actually, it's an amazing step because, you know, it showed how we are serious. Can you imagine in less than 1 year you can examine around 60 million Egyptians? This is, it looks very amazing and looks, you know, a role model for the whole world. So I think it's, and it's looking for the many, for example, the hepatitis C, for example, they call it the monster of health diseases.
Yes.
It's a ghost for the health professional, but we and also I'm very happy that they look for the non-communicable diseases, because the non-communicable diseases maybe account for more than 80% of the deaths in Egypt. It's not just the communicable, like hepatitis C, just looking for the heart disease, looking for the hypertension, the COPDs, looking for many diseases having the chronic diseases or non-communicable disease. What they did is that they looked for the risk factors for all of these, and what, of course, we all know that the risk factors for the non-communicable diseases are more or less the same. They look for the obesity, they look for diabetes, they look for the hypertension, and this really, it was just an amazing, because in Egypt we have really alarming numbers. Egypt is the fattest country in Africa. This is very important. It's number 6 or 7 for diabetes, hypertension as well. So we do have we have an epidemic of diabetes too. I think they did a big job. I'll tell you a step to show you how this initiative gave some response, because the lifespan of the Egyptians now it's a little bit raised, and it's, as was published in the 2019, for females it's around 73 years old, and for males it's 71 years old, and it jumped around 1 year more. So if you compare us with other countries in Europe or in the USA, the lifespan of Egyptians have jumped, increased, but in other countries it is stationary, maybe less. And maybe the coming year we will find more and more impact of what did this initiative.
Yes, definitely. Well, Dr. Kamel, you've raised a very important issue, which is the financing of it, and you want to reach a self-sustainable financing system.
Yes.
Now, does that mean that there will be a bigger role by the private sector actually playing within this health insurance system? How's it going to be, what is the nature and the dynamics of the cooperation between the public sector, the government, and the private sector in applying such a comprehensive system?
Well, something you need to have the data before. This is where the 100 million healthy lives initiative gets. You have like tremendous data. Everybody's working on it, because now you know actually the numbers, and you know what you're going to be needing over the next years. So you can like find the resources to deal with that. There are like some issues that won't be covered by the health insurance that will continue to be free, provided by the Ministry of Health, like vaccines, infectious diseases, maternity and birth control. All of these are going to be still provided for free for everybody. But during the rollover and afterwards, you have financing methods so that you have a sustainable system. So you have subscriptions that's like 1% of your income, 2% of your income, 3% of your income, depending if you're an employee or a business owner. and it's for the whole family, not just the guy who the bread bearer, the person who works, and then you have the government to pay on behalf of those who cannot afford to pay the subscription. Where is the government going to be financing this from? So we have a new tax, an excise tax on cigarettes and tobacco, that is going to be dedicated to the and alcohol. That's going to be dedicated to help the Minister of Finance finance the system, so that it is sustainable. You don't want a system that would go every year borrowing from the budget. This is a sustainable system. It has its own taxes, and it has its own subscription, and hence the rollover, because we're starting in a few governorates over the Canal Zone, North and South Sinai, and afterwards we're going to Luxor, Aswan, reaching Cairo by 2032. So we have quite some time, a learning curve that we have, so that we can have this. And if any mishaps happen, then the state can help during the rollover, but not with something that deals with 100 million people. It's just a controlled study. So the private sector is already helping. They're with us in Port Said, where this is all happening now. And it's not just the Ministry of Health. It has the Ministry of Finance, the Ministry of ICT, the Ministry of Military Production, the Governor of Port Said, and Administrative Affairs. All of them are working together to help us develop a system. The private sector, hospitals, all of them, the big names, are helping us train the hospital staff in all of the Port Said hospitals, the nursing and the doctors. And the idea is that we will have the health insurance system, we will have prices, a price list for every surgery, for every investigation, for every intervention. And this is what the system pays for this patient to have an MRI, to have this surgery. And if I own a hospital and this patient comes to me and I agree to these prices that have been set by the authority, then this patient can walk into any private hospital, just give his ID and have the service as any paying customer.
But what about the private sector? I mean, they would make much more money if they set their own prices, and the patients would actually go to the hospitals, the private hospitals, and pay much more than under the health insurance system. What would encourage the private sector to get in?
It is impossible to happen. If you have insurance, you would seek to have health care that your insurance covers. Look around you. If anybody who has insurance would go seek health care in an insurance-covered hospital, why would he go pay out of pocket while he has health insurance in a good hospital that provides excellent service? The competition of having health coverage for everybody would prevent the exploitation of patients using schemes where, like, you don't have health coverage, you have to pay X and X and X for having health care, or else you die. This theoretically wouldn't be able to happen afterwards, because the patient is covered from A to Z. If he requires exceptional services that are not provided by the health insurance hospitals, well, this is a situation when there is something like liver transplantation or something like that is not covered by the current model of insurance. Then probably there has to be a situation where this can be financed, but regular Joes, not for everyday illnesses, no.
Yes. Well, Dr. Nasser, if we're going to be talking about having an all-inclusive sort of health insurance system, now you will need some sort of healthy competition between all different hospitals. Does that mean that the public hospitals now, the health insurance hospitals, will witness a lot of transformation or restructuring or development in their facilities, in the services they provide, in the nursing services that will be available?
Yes, of course it's true, because you have to improve your infrastructure, because if we are going in a competition, you have to raise the standards in the general hospitals, and this is what they are trying to do now, and I think it's a difficult job, but they are doing a lot of effort to bypass the differences between the different hospitals. Also, this very important item that you have 3 different governors of the system. So you do have the one who is going to audit, and the one who is going to give the service, and the one who is going to get the money. It's very important, because it is not logic that you that you audit yourself. You have you have an extra part who's auditing you. So I think we are on the right way. I think we are we'll witness improvement in the healthcare system in Egypt. So I'm very happy about that.
Yes. Well, applying this system across the whole of Egypt is going to take some time, a few years, on different stages and phases. It starts off with the governorate of Boursaid. Now, why was Boursaid specifically chosen to be the first governorate trying to apply the insurance system there? And what sort of difficulties or expectations, expecting certain problems or challenges for applying such a system?
They started with Port Said, because Port Said is having around 600,000 citizens. This is very low. Can you compare that with Cairo? Cairo having around 20 million or something like that. So you cannot compare along with Port Said. Also, Port Said has the advantage is that it actually have no villages, not a lot of small little villages. So you can apply, and then you will have a perfect learning curve, so that when you have some pitfalls in applying the situation in Port Said, you can improve yourself. Afterwards, they're going to Ismailia. They're going to cover the Suez Canal area, and then by the year 2032, they will come to Cairo, which is maybe will be the hardest. They will have come across a lot of difficulties, a lot of improvements, a lot of experience of how they improve it, and I think this is a very nice step and a very good start.
Yes. Well, Dr. Kamel, what about, as Dr. Nas mentioned, not just the treatment of the already existing diseases or the already existing suffering patients, but what about the prevention of it? How much attention is being paid and efforts exerted to work on the prevention of and changing this whole culture, the medical culture within the Egyptian citizen? Is this also included in the health insurance system?
Well, as I mentioned before, vaccines and basic preventive medicine are going to be still for free for mothers, for babies. You cannot have this as part of any insurance coverage, because it has to remain a basic right for every Egyptian. That's one thing that's clear. The other thing is when money is involved, because there's going to be a huge competition between hospitals, because they will be making a lot of money because so many people are now covered, and they will seek health coverage at hospitals that they normally wouldn't go to because they couldn't afford. So when money is involved, then this is going to create competition between hospitals, and this is going to improve the healthcare service. And then when money is involved, the audit and evaluation of the use and abuse of treatments and investigations and the outcomes are going to be evaluated, and then hospitals are going to be ranked, and the whole healthcare system is going to be benefiting from this. When it's just like service that is suboptimal and you're providing it for free, and people they're not paying anything and they're not getting anything. Now, there is money being paid. They have been paying their subscriptions, and they are receiving a service that they can hold the service provider accountable for, and he or she are getting paid for it. So this whole system is going to make the health system better. The data that we got from 100 million healthy lives is going to help us identify where are the problems that are facing the Egyptian population. Why are we the fattest country in Africa? Why do we have like such a high prevalence of diabetes and heart disease and everything? This is going to working with other ministries like the youth and sports and everything to help avoid certain bad habits and encourage people to use the health insurance that they have, because people are not seeking health insurance not just because that it's their culture not to go to doctors, because it's been customary that this is expensive and this is exhausting and this is humiliating. Now all of this is going to go away, and they are going to have a right to have the treatment that they deserve, and this is going to have a very positive effect on the way they treat with themselves and the way they deal with the health systems, because Egyptians that have insurance go to hospitals all the time and receive all the treatments that they require on time.
And does that include also the campaigns about leading a healthy life, leading a healthy diet, birth control? Is that included in these?
Well, as I told you, birth control is going to continue to be free, and these campaigns are going to be led by the Ministry of Health, taking away the burden of financing and running the hospitals from the Ministry of Health, and helping them have like the health policies for the whole country is going to help them do more of these campaigns. And then the competition between the healthcare providers is going to give us more and more initiatives.
Yes. Well, ladies and gentlemen, also the Mufti of the Republic praised President Sisi's efforts in introducing and encouraging and upgrading the healthcare sector. Let's check out this report and we'll be right back.
Mufti of the Republic Dr. Shawqi Allam has praised President Abdel Fattah el-Sisi's concern with the health of the people and the great initiatives taken to develop the health sector. Addressing a consultative Islamic World meeting held at Al-Azhar headquarters to discuss eradicating infantile paralysis or polio, he said the participation of Al-Azhar, the Organization of Islamic Cooperation and other Islamic institutions give hope in eradicating such a dangerous disease. He noted efforts to eliminate all obstacles that hinder development and progress in the Islamic nation for the best interest of mankind, regardless of race, color or religion. Meanwhile, the Health Ministry said in a statement that new comprehensive healthcare insurance systems guarantees offering a high-quality service to all segments of society without any discrimination. The ministry said the new system gives beneficiaries the freedom to choose their health service providers and reduces personal spending on medical care. It said that financially challenged citizens would be exempted from subscription fees. The pilot stage of the new system is currently being applied in Port Said through 11 general and specialized hospitals and 32 healthcare units. Under the new system, citizens will head for the nearest health unit to their place of residence and conduct any type of medical test they need. The units will refer them to hospitals if necessary for more advanced tests. The new system will cover all the governorates by 2032. The efficiency of the Port Said hospitals were also increased over the past 6 months to implement the new system. Among the medical services to be provided are open heart surgery, bone marrow transplantation, kidney and liver specialties, neurology and microsurgery. The new system's second phase will start from 2021 to 2023 in Al-Aqsa, Matruh, Red Sea, Qina and Aswan. The third phase, 2024 to 2026, will cover Alexandria, Beheira, Damietta, Sohag and Kafr al-Sheikh. The fourth, from 2026 to 2028, will be in Bani Suif, Asyut, Minya, New Valley and Fayoum governorates. The fifth phase, from 2029 to 2030, will be in Dakhahliya, Shar'iyya, Gharbiya and Menufeya governorates. And the last stage will be 2032 in Cairo, Giza and Qalyubiyya governorates.
Welcome back, ladies and gentlemen. Dr. Nasser, now, being an African representative of the International Society, the President spoke about cooperating with the other African countries, the African states, really taking these initiatives and going out and helping the other African countries. How is Egypt going to carry that out? And how is that going to affect Egypt's status economically and politically as well?
Well, because Egypt, thanks to God, President Fattah al-Sisi is sharing the African Union. We are lucky to be in this year, and that means that Egypt is going to lead the African health as well as politics, as well as everywhere. One of these is just the extension of the initiative of 100 million healthy lives to extend in Africa. And amazingly, they already started to start this initiative in Africa, and also they started already in Egypt looking for the hepatitis C as well, and giving even medications for those affected by hepatitis C. Also, we're very concerned with prevention, so I think we do have in the coming years to look for the prevention, to look for the healthy lifestyle, to look for the healthy environment, and I think Egypt is its right way to lead Africa in this issue.
Yes, and we've already sent an Egyptian delegation to South Sudan in Juba, checking for the hepatitis C unit. Yes.
Last week this was done. So we're just starting very energetically and very quickly, and then looking forward to have initiatives in all countries in Africa.
Yes. Well, Dr. Kamel, you're a former advisor and a spokesperson to the Minister of Health and Population. Now, how are we performing in terms of the WHO's 5-year plan? Are we working in the right pace? Is it going to pick up faster? Are we meeting all the requirements and the aspirations of such a 5-year plan?
Well, I think Egypt is doing very well. And actually, I think we have been a trendsetter in certain fields. And for the first time in years, the world is looking at some of the accomplishments that have happened. For me, as a doctor, I couldn't possibly imagine that we could treat so many Egyptians that have contracted hepatitis C. We had a problem, a serious problem that every single government would shy away from. We have currently cured 100% of Egyptians that were diagnosed with Hep C. And we have been sending out, time after time, mobile labs, campaigns that are diagnosing those that are undiagnosed with the disease. This disease has cost us billions of dollars over the years. It has killed so many Egyptians. It has affected everything from our workforce, our economy, and now we are seriously getting rid of it. It's the slogan of the campaign, Egypt free from Hep C, and then a world free of Hep C. We were so bold saying that we want to lead the whole world with our own model to get rid of this disease, just to go away, like smallpox or something like that. So this is one thing. The WHO has time after time said that the Egyptian experiment or the Egyptian accomplishment in combating Hep C is something that should be applied in every other country that has such a disease, not just Hep C, other diseases that have such treatments. So this is why we are boldly moving into Africa. We're exporting drugs, and we're making a lot of profit out of it. It's not just aid from Egypt, it's cooperation. Because if they import such drugs from the United States, for instance, they would pay like 20 times or 25 times the price. Okay, so we are making money, and they are treating their patients, and also we are giving aid to poorer countries like South Sudan and others, and this is helping us all. This cooperation is helping us all. And then after we did that, we did the 100 million healthy lives, which is like the biggest campaign worldwide to diagnose non-communicable diseases and to gather such a tremendous amount of data, and at the same time we're rolling the biggest healthcare system application in modern times. Nobody has rolled such a comprehensive health coverage for 100 million people in such a 15-year-old period. It's not a very long time.
Yes.
So we are moving really quickly in the health field, and people, when they look at the health field, they look at like the hospital that they are going to. And this is like a very small portion of the healthcare system. So we are developing and we are making a difference, and future generations are going to be living in a country that provides them with health care. And it's no longer going to be a question. It's going to be a basic right.
Yes. Dr. Nasr, now, what about the pharmaceutical industry? How is such a healthcare insurance system affect the pricing of medicine? The pharmaceutical companies, are they going to be under the focus of as well? Is there going to be a set standard price for all medications? Is there going to be certain activities and certain rules and obligations that the pharmaceutical companies need to operate under?
Yes, of course. Of course, as we have said, that there will be preset rules to share in this, standards. So I think there will be definite standards. They will be under auditing. They will be having, definite regulations in order to withstand in a good form. Also, maybe there will be encouragement of the national industry in Egypt. Of course, we were looking forward to have some sort of drug FDA as the other in the United States and so. So we think this on its way to have a definite organization for the drugs in Egypt, the drug industry in Egypt, and we are already on our way.
And do you think this will affect the imports and the exports of the medicines here?
Because we are longing to exporting drugs to Africa. This is. And this is our place. This is where we should be. We should be leading Africa. And as Dr. Kamel have said, that you just imported, you have a profit. It's just, and you'll have drugs, exporting drugs, which is much, much less in cost than coming from European countries or from the States. So it's just a matter of how cheap you're going to give a high-quality drug, and that's what we're aiming to. And I think this will be soon happening in the very near future. And as we have, tackled the problem of prevention and screening, looking for millions and millions in a very short time, in less than 1 year, we were able to do this big achievement. I think. We are in the few coming months, we are going to have a big achievement also in the medications and the treatment of Africans.
Yes, hopefully so. Dr. Kamel, because this is the last question because we're running out of time. Now, with your experience within the Ministry of Health and Population, as we are embarking on this health insurance system, well, nationwide, what do you see are the main potential hurdles or challenges or obstacles that we might need to overcome?
Well, we're not going nationwide yet.
Yes.
We're in Port Said. There will be hurdles, and there will be difficulties, and this is why we're having a pilot study. Systems will fail, people wouldn't understand, doctors wouldn't be working well within the systems, hospitals will still be resisting change, nursing, everything. But eventually, you will identify all the bottlenecks, all the hurdles, all the problems, and you will overcome this. The goal is that you have a sustainable, self-financing, comprehensive health coverage for all Egyptians. Medicines, you will still have pricing, but you wouldn't be worrying about people not being able to buy medicines because they're too expensive, so that you put them below the market price and then the manufacturer wouldn't make them. Now, everybody would be receiving their medicines for free, and the insurance company would be paying. And the insurance company would be the one negotiating the price with the pharmaceutical company. This is going to be very healthy for everybody.
Yes. Well, ladies and gentlemen, definitely these are the first steps for implementing a health insurance system nationwide. The first steps, it's not nationwide yet. It started off in Bursaid, and as our distinguished guest, it is quite promising. Some of these steps would be considered leaps in medical achievements. Unfortunately, that's all the time we have for this edition of the Daily Debate. But before we go, I'd like to thank our very distinguished guest, Dr. Jamila Nasser, the head of the Working Group of Prevention of the Egyptian Cardiology and African representative in the International Society. I'd also like to thank very much Dr. Ahmed Kamel, the Associate Professor of Neurosurgery and former advisor and spokesperson to the Minister of Health and Population. Thank you very much for joining us this evening. Ladies and gentlemen, please stay tuned for more coming up on Nile International. I'm Hani Saif. Thank you for joining us.